I'm going to knock on the patient's door. I'm going to enter the patient's room, pull the curtain for privacy. I'm going to perform hand hygiene. I am going to don my gloves. Okay, I'm going to educate the patient on what I'm here to do today. Hello, my name is Kevin. I'm your nurse today, and today I'm going to be performing a head-to-toe assessment on you. Is that okay?
Yes.
Okay. I'm going to now identify the patient. What is your name?
Amelia Vasquez.
Okay, and your date of birth?
10/01/01.
Okay, and then I'm going to check the patient's wristband, and everything matches. I am now going to begin assessing their scalp. There are no lesions or abrasions on the scalp. Hair is intact. I am going to assess their skin. So the patient's facial skin, neck skin, and then their abdominal skin, arm skin, and leg skin. So everything is intact, no lesions or abrasions or bruising. I'm now going to assess the patient's eyes. So based on inspection, the patient's eyes there are no lesions or abrasions. I'm going to pull down the patient's conjunctiva, and I'm going to assess their sclera. Sclera is white. I'm now going to assess their eyes. I'm going to bring the pen light from the outer to inner. Patient's pupils are equal, round, and reactive to light and accommodation. I am now going to have the patient follow the pen. The patient's cardinal of gaze is fully functional. I'm going to assess the patient's nose. Nostrils are non-obstructed and moist. I'm going to instruct the patient to occlude one of their nostrils, and then do the same for the other side. And the patient's nostrils are patent, no obstruction. I'm going to assess the patient's ears. Ears are, there's no obstruction, no cerumen buildup. I'm going to assess the patient's mouth. Okay. Teeth are intact. Oral mucosa is moist. I am now going to palpate the patient's lymph nodes, their trachea. Lymph nodes do not appear swollen. Trachea is midline, no deviation. I'm going to assess the patient's skin turgor. The patient's skin does not show tenting. I am now going to listen to the patient's lung sounds. Go ahead and breathe in. I'm going to do it for your back. Patients, there are no adventitious lung sounds. Patient does not show labored breathing. I'm now going to assess the patient's heart rate. Patient's cardiovascular heart sounds do not show irregular rate or rhythm. I am going to assess the patient's pulses. So their radial pulse. Okay, and then their dorsalis pedis pulse. And there's 2 plus pulses in the upper and lower extremities. I'm going to assess the capillary refill. Capillary refill in upper extremities is less than 3 seconds. Capillary refill in lower extremities is also less than 3 seconds. I'm now going to have the patient lie down. Okay, I'm going to instruct them to pull up their shirt. Let me know if you're uncomfortable while I inspect your abdomen. Okay, so based on inspection, the patient's abdomen does not appear distended. The skin is intact. I'm now going to listen to their bowel sounds. Patient's bowel sounds are active in all 4 quadrants. I'm going to palpate. No protrusions in all 4 quadrants based on palpation. I'm now going to have the patient pull down their shirt and then they'll sit back up. Okay, now I'm going to assess their strength. I'm going to have the patient guard up their arms and you're going to push against mine. Okay, same thing with your lower extremities. So the patient has full strength. I'm now going to have you move your arm in circular motions. Same thing with your ankles. Okay, so the patient has full range of motion. Yes. I am going to have the patient stand up. Okay, I'm going to place my hand on their chest and have them lean forward. And then go ahead and touch your toes. Patient has full range of motion and full back strength. I'm now going to instruct the patient to walk forward. Walk towards me. Patient is fully ambulatory, no gait issues. I'm going to have the patient sit back down. Okay, now I'm going to assess the patient's orientation by asking them questions. What is your name?
Amelia.
What is your date of birth? Oh.
10/01/01.
Yes. Where are you?
Nightingale Hospital.
What is the time?
12 o'clock in the afternoon.
Okay. So the patient is alert and oriented times 4. Based on the Glasgow Coma Scale, the patient's Glasgow Coma Scale would be a 15, indicating that her eye and motor functions are fully intact. Okay, so that concludes the head-to-toe assessment. I'm going to place the patient at the lowest level, provide them with a call light. I will remove my gloves, perform hand hygiene, exit the room, close the door or not, depending on their preference, and then I will chart that the head-to-toe assessment is complete.